Greetings. Welcome back to the Medical Weight Loss Show. I'm your host, Dr. Andrea Walker, family nurse practitioner, weight loss specialist, IFBB Pro, and founder of Serenity Health Innovations and Wellness. Today, I want to address something that has been all over the news just this week. Headlines claiming that Ozempic is the cause of death for at least 3 people. If you see these stories, it can sound alarming. Patients are asking questions, and understandably so. But today, I want to walk through what actually happened, at least what we know, what the FDA really said, and why the current media coverage is somewhat misleading. This episode is strictly fact-based. No hype, no fear-mongering, just the medical facts. So sit back, relax, grab you a cup of tea or some water, and let's get started. Recently, several major news outlets reported that the FDA issued a warning to Novo Nordisk, the manufacturer of Ozempic and Wegovy. The headlines focused on the idea that deaths connected to Ozempic were not reported, which understandably raised concern among patients and providers. But the key point here is this: the FDA warning was about reporting procedures, not proof that Ozempic caused deaths. And that distinction is incredibly important. So, what actually happened? During an FDA inspection, regulators determined that Novo Nordisk failed to properly report certain adverse event cases within the required timeframe. Under federal regulations, drug manufacturers must report serious adverse events within 15 days after they become aware of them. The FDA identified 3 cases involving patients taking semaglutide, the active ingredient in Ozempic and Wegovy. Those cases included 2 deaths and 1 suicide. However, and this is critical, these cases were potentially linked reports, not confirmed causes of death. When reporting adverse events with patients taking medications, any serious event that happens while someone is taking a medication must be reported, even if the medication had nothing to do with the outcome. Now, let's talk about how association does not mean causation. This is something we discuss often in medicine. Just because an event happens while someone is taking a medication does not mean the medication caused the event. For example, if a patient taking a blood pressure medicine dies in a car accident, that death could still appear in an adverse event reporting system. The FDA's system is designed to detect possible safety signals, not to prove cause and effect. So just because the patient died, they were driving a car, they had an accident, does not mean that the medication that they were taking was the cause of death or even caused the accident. So when you hear that a medication is linked to deaths, what that usually means is the events were reported while the medication was being used. It does not mean the drug caused those deaths. Now, the FDA continues to evaluate reports related to GLP-1 medications, but so far, their review has not found evidence that these medications cause suicidal thoughts or actions. And I'll back that up with the statement on the FDA's website. You can check it out at fda.gov. Over the last several months, we have concluded detailed reviews of reports of suicidal thoughts or actions received in the FDA adverse event reporting system. Because the information provided was often limited and because these events can be influenced by other potential factors, we determined that the information in these reports did not demonstrate a clear relationship with the use of GLP-1s. Similarly, our reviews of the clinical trials, including large outcome studies and observational studies, did not find an association between use of GLP-1s and the occurrence of suicidal thoughts or actions. However, Because of the small number of suicidal thoughts or actions observed in both people using GLP-1s and in the comparative control groups, we cannot rule out that a small risk may exist. Therefore, FDA is continuing to look into this issue. And it's worth remembering that GLP-1 medications like semaglutide have been studied extensively in clinical trials involving tens of thousands of patients. These medications are FDA approved for type 2 diabetes, chronic weight management, and cardiovascular risk reduction in certain patients. And multiple studies have demonstrated significant health benefits, including reduced cardiovascular events in people with obesity or diabetes. Now, let me address this about the compounded versions. They are not FDA approved. Do I still use those? Yes, I do. What that means is that they are just compounded by a compounding pharmacy, and I use facilities that are either 503A or 503B compounding pharmacies, which means the 503A and B have to have some type of regulation, the actual facility where the medications are compounded. But just like vitamins, several over the counter, probably all over the counter medicines, none of those are FDA approved. So don't let that be the part that scares you. Here's the thing about the compounded version. Many patients are taking those medicines. They're not following up with their doctors. They're just dosing their own cells. They're increasing their dose every week, every, 2 weeks. I've had people tell me that they were taking it every day because they didn't know that it was supposed to be once a week. Will that end up hurting you, sending you to the ER, possibly causing death? Absolutely. So just be careful. I personally do not think there's anything wrong with the compounded versions as long as they're coming from either a 503A or 503 compounding pharmacy. That's something you would not know, but that is something that your healthcare provider would know. And yes, there are healthcare providers who do not order from 503A and 503B, and that's on them. If something were to happen, or if their nursing board or their medical board found out about it, then they'd probably be in some type of trouble and fined. There have even been clinics that were shut down because they were not using 503A and 503B facilities. So, but that's another story, but I just wanted to address the compounding version. This episode is more so focused on Ozempic, which is the brand. And the reason I did this episode was because I was reading the headlines and they were just way overboard. They were just doing and saying too much. And unfortunately, the media typically provides misleading information. Things like deaths linked to Ozempic. It can create the impression that the medication itself is dangerous or unsafe. And that's simply not the truth. The FDA warning was about reporting compliance, not proof of drug-caused deaths. And millions of patients worldwide continue to use GLP-1 medications safely under medical supervision. My advice as a medical provider, if you're taking a GLP-1 medication like Ozempic, Wegovy, Mounjaro, or even any of the compounding versions, the most important thing is to work with a qualified healthcare provider. That's the bottom line. Like any medication, these drugs do have potential side effects. But for many patients struggling with obesity, diabetes, and metabolic disease, the benefits can be life-changing and life-saving. In closing, medicine is always evolving. Safety monitoring continues long after medications are approved, and that's actually a good thing. It means the FDA and manufacturers are constantly reviewing new data to ensure patient safety. But it's also important that we interpret those reports accurately and responsibly. And right now, the evidence does not show that Ozempic is causing deaths, despite what some headlines may imply. Thank you for listening today on the Medical Weight Loss Show. If you found this episode helpful, please share it with someone who may be confused by the recent headlines. And if you want medically supervised weight loss care and you live in Florida, Tennessee, or Arizona, feel free to reach out to me at Serenity Health Innovations and Wellness. Until next time, stay informed, stay healthy, make sure you drink your water, make sure you meal prep and work out. And I'll see you on the next episode. Bye for now.